Hey everybody, welcome to the AI Guide on YouTube, where we focus on the human impact of AI. So today's episode is, do you know what AI is being used on you when you go to the doctor's office now? So as you guys may or may not know, all medical devices and medications that you are given must be approved by the FDA. But is that all that is being used in terms of AI today? Drugs discovered by AI and/or medical devices enabled by AI? Let's find out about that right now. Doctors are already using unregulated AI tools such as note-taking virtual assistants and predictive software that helps them diagnose and treat diseases. And we're going to hear an interesting story on that a little bit later. Government has slow-walked regulation of the fast-moving technology, meaning AI, because the funding and staffing challenges facing agencies like the Food and Drug Administration, FDA, in writing and enforcing AI rules is vast. It's unlikely they will catch up soon. That means the AI rollout in healthcare is becoming a high-stakes experiment in whether the private sector can help transform medicine safely without the government watching them. The cart is far, far ahead of the horse, says John Ayers, associate professor at the University of California, San Diego, and this article is courtesy of Reuters. Unlike medical devices or drugs, AI software changes over time. President Joe Biden in October promised a coordinated and fast response from his agencies to ensure AI safety and efficacy. But regulators like the FDA don't have the resources they need to preside over technology that, by definition, is constantly changing, and as my viewers know, changing at an exponential rate, which automatically means government can't keep up. But let's hear more. We need another doubling of the size of the FDA, and last I looked, the taxpayer is not very interested in doing that, FDA Commissioner Robert Califf said. Evaluating AI because it is constantly learning and may perform differently depending on the venue where it's used is a monumental task that does not fit this agency's existing paradigm. When the FDA approves drugs and medical devices, it doesn't need to keep tabs on how they evolve. The agency wants more power from Congress to request AI performance data and to set guardrails for algorithms in more specific ways than its traditional risk assessment framework for drugs and medical devices allows. Congress is traditionally loath to expand FDA's authority, and so far FDA has not asked for this yet. And by the way, see the short I did this week on this exact topic of AI in healthcare. It has offered guidance to the medical device makers on safely incorporating AI, sparking an industry backlash from tech firms that say the agency has overreached, even though guidance is legally non-binding. Advancements in AI have created big gaps in what the FDA regulates. 14 months ago, Congress granted the agency the power to allow makers of devices, some of which include early AI, to implement pre-planned updates without having to reapply for clearance. But the scope of FDA powers over AI are unsettled, and indeed that's true of all federal agencies. The Healthcare Information and Management Systems Society, a trade group that represents health technology companies, also expressed confusion over the scope of FDA authority and how power over AI is split among the FDA and other federal agencies. So they haven't even really started to figure out how to handle AI at the federal government level yet, which we'll talk much more about in just a bit. Meanwhile, the FDA told the GAO, Government Accountability Office of the U.S. Congress, that to proactively track whether algorithms are effective over time, it needs new authority from Congress to collect performance data over time. The agency also said it wants new powers to create specific safeguards for individual algorithms. However, Capitol Hill is gridlocked, which I think we all know. By the way, there's a huge number of personal questions raised by this discussion that we'll get to. Another idea, the creation of public-private assurance labs, probably at major universities or academic health centers, which would validate and monitor AI in healthcare. So that's an alternative idea to regulation. The idea also has some support in Congress. That approach, however, could have flaws, as some AI experts have noted, since AI tested on a major university campus may not work well at a small rural hospital, where they have much less computing power, obviously. You know, as a practicing physician, that different environments are different, said Mark Sendak, Population Health and Science Data Lead at Duke University. Every healthcare organization needs to be able to locally govern AI. So there was an article in the Journal of the American Medical Association, which is the Bible for doctors, if you will. The article calls for a small number of pilot labs to lead the way in designing validation systems. But seeing that collaboration among regulators, major universities, and healthcare providers has not reassured smaller players who worry about conflicts of interest if the pilot labs are organizations that are also making their own AI systems or collaborating with tech firms. So in other words, they'll give their own systems or a partner's systems a free pass, which is a legitimate concern if you read the newspaper at all. Ayers thinks the FDA should be handling AI validation within its own walls, and that makers of AI systems should, at a minimum, have to show that they improve patient outcome. Personally, to me, that seems like a reasonable benchmark. He noted the failure, this is the story I told you we were going to get to. He noted the failure of an AI system from electronic health records firm Epic to detect sepsis, a sometimes fatal reaction to infection that had slipped by regulators. If you want to see more on sepsis, watch The Day After Tomorrow, the movie. The company has since overhauled its algorithm, that's Epic, but the incident left many in healthcare and technology feeling like the FDA isn't using its current authorities effectively. They should be out there policing this stuff, said Professor Ayers. But we know from earlier in the article that the FDA said they have nowhere near the staff they would need to do that. So what is the big picture here? This is what's really, really important about this article. Number one, who and how AI will be regulated in the United States, unlike Europe and other places, is completely unclear, which means that they're already catastrophically behind. Why? Because AI is an exponential technology developing at exponential speed. In the meantime, AI is therefore advancing at breakneck speed. So that makes sense that government would not be able to keep up with this, which leaves human beings, us, as being the guinea pigs for this huge experiment in medicine that is starting to take place. But at an even deeper level, which is what we like to get to, the deepest fundamental level of all of this is that nothing will stop the development of AI. Nothing. Why? Government hasn't even begun to figure out how to regulate it here. In the meantime, AI is exponentially improving, and there's an old expression that old folks used to say 50 to 100 years ago. While Rome burned, Nero fiddled. The meaning of that expression related to this article is Congress is gridlocked and is taking so long to figure anything out that it'll be far too late by the time it does. So what can be done? Well, one thing that you have to ask yourself is, don't you want to know when you go to the doctor how AI is being used in your care? There's a simple way to find that out. Ask them. Secondly, if you're proactive, write your congressperson or senator and tell them you want AI in healthcare strictly regulated. Why? Because your own personal health is at stake. So these are some thoughts for you today. As always, we try to talk about what this means for you. It means that you are in charge of your own well-being. That's what it means. If you like this episode, please like, subscribe, and share. Really important for us right now. Also, please support us on Patreon, link immediately below, because with your support, we can do way more than we're doing right now, keeping you on the cutting edge of what's happening in AI and how it affects you. So thanks so much for tuning in. We'll see you next time. Take care. Bye.